Hello viewer, hujambo. Welcome back to this YouTube channel of which we are now calling it GTN Nursing Services, where we give health talk on mother and child health care. We are having a series of learning whereby we are learning how to assess a child for developmental milestones. We left when we said that the milestones that are checked, or the markers that we check to know whether the child is having a healthy milestone development, are the gross motor, the fine motor, the language, the cognitive and social, emotional and behavior. So the question is, what does it mean gross motor? What does it mean fine motor? And what does it mean language, cognitive and social, emotional and behavior? So when it comes to gross motor and fine motor, it involves how the child makes the body movement. Yes, the body movement of a child are the indicators of how the gross motor and fine motor are functioning. When it comes to language, it is about communication. How is your child communicating? Is your child able to repeat what you tell the child? Is your child able to say some words, though they are not very clear, murmuring some words? That is about communication. When it comes to cognitive skills, it's about learning, thinking, and problem solving. You can ask how a child of 1 year will show signs of learning. Yes, if you're having a book, you point at something, the child will be able to tell the difference between this one and this one. Then when it comes to social emotions and behavior, it involves how the child interacts with others and show emotions. Yes, that is the 5 milestones, developmental milestones that we are being asked to be able to assess when we are taking care of our children. So, what is the problem if you find that your child is not able to do some of the things it is expected to do at a certain age? The problem is this child is having a delayed milestone, and this child may require further assessment by a specialist for possible enrollment in a program that promotes recovery and hence reaching a full potential of functioning. So any child who is having any of the milestones delay might require further assessment by a specialist so that the child can be enrolled in a program that is going to promote full recovery, and then the child is going to go back into the normal functioning of the domain that has been delayed. Okay? So, another question that we might ask ourselves is about this delay. We are being told that delay can be in one or more of the domains that we talked about. So, developmental milestones delay can be specific, that is present in one area, or global, that is present in greater than 2 areas. Yes, children can present initially with only a specific delay, but can go on to develop subsequent delays in additional areas of functioning, this advancing to global delay. When it is one part, it is one part. But if it is more than one, then it's going to be said to be global delay. So if there is delay more than 2 parts, that is said to be a global delay. We are told that the earlier delays are identified and addressed, the more positive the prognosis. So if you are able to note that your child is having a problem, make the child be assessed by a specialist, the earlier the response is done, the quicker the recovery to this child. Now, we are told that once the delay in milestone development is identified and reported, the clinician or health provider must try and find the related cause. Yes, when a child is having a delayed milestone, we said that monitoring of a child is by the caregiver and health worker. So when you report to the health worker is supposed to assess the child further, and if there is any problem, the health provider is going to try and find the related cause. Example, a child with a speech delay may have a underlying hearing problem. We talked about language. Language is about speech. If a child is having a speech delay, they may have an underlying hearing problem. A child with a visual problem, that is shida ya macho, may have delay in motor development. We talked about fine motor and gross motor. So when a child is having visual problem, they may have delay in motor development. We are being told that genetic and metabolism conditions may also precipitate developmental delay, often global in nature. Genetic and metabolism. The word genetic means it is running in the family. Metabolism means anything to do with food digestion. So any genetic and metabolism condition may also precipitate developmental delay, often in global in nature. Another thing we are told is that prolonged labor or birth trauma, prolonged delivery or birth trauma may lead to brain damage with the effect on milestone development, often global in nature, a condition referred to as cerebral palsy. Yes, so prolonged labor or birth trauma may lead to brain damage with the effect on milestone development, often global in nature, a condition referred to as cerebral palsy. Okay, we are also told there are some conditions associated with the delayed milestones, and these include autism spectrum disorder. A condition called autism spectrum disorder, AMA ASD, is associated with the delayed milestone. This is where a child presents with the deviations in areas of social emotions and behavior. Okay. Another thing is that hearing impairment and cerebral palsy may lead to attention deficit hyperactive disorder. You see, hearing impairment and cerebral palsy may lead to attention deficit hyperactivity, a condition called ADH, that is attention deficit hyperactivity disorder. Is it clear up to there? So we are told that the best way to monitor child development is to track their developmental milestones. And the developmental milestones are the things children can do by certain age. Developmental milestones offers important clues about a child's developmental health. Okay? So, using our MOH booklet, the one that we always use as a reference point, next lesson, we will see how all these 5 developmental milestones are assessed in combination, so that when you are at home with a child, in case you pinpoint any of a delay, it is good to report to the health worker immediately, so that the health worker can check any associated problem with the delayed milestone. And if possible, the child should be enrolled to programs which are going to make the improvement of the child earlier. Okay, thank you.